they were a little low, and did some repeats, and they were all within like 250, 300. Uh, top, I think I topped out at like 400. And I just wasn't feeling great, and so that's what kind of led me down the path of experiencing it.
Yeah, it's surprising how many of our patients have similar kind of like epiphanies, different reasons too. Also, like my dad was a firefighter. He can
Yeah,
he'd be the first one to attest to the dietary things. He said that when you eat when you can eat, and a
yeah,
lot of times it was just as much as possible there. All right,
yeah,
question number two. Were there any concerns or hesitations you had before starting TRT, and how were those addressed by reverse medical?
yeah, for sure. TRT isn't something that you just hop on. Having a little bit of a background in the medical field, I could understand a lot of different things. Um, the there's a lot of things that can go wrong. There's a lot of things that you should do and shouldn't do. But since I started, I looked at other companies. I did lots of research. I probably researched for 2 months, just real heavy, and trying to find a good, reputable company that fitted me. I reached out to Reverse Medical, and within like I think 35, 40 minutes, I had somebody contact me back and really explain the process. It wasn't a sales pitch. I never felt pressured to anything. It was more, hey, how are you doing? Me as a patient, you guys addressed my concerns. And I think within 2 hours, I was on the phone with Dr. Rucker. And it just all uphill from there. I mean, it's been awesome, awesome experience.
That's great to hear. Question number three. How did Reverse Medical's team guide and support you throughout the process of starting TRT and during the course of the treatment?
Yeah, reverse medical's been there every step of the way for me. I mean, anytime I got a question, it's answered back in a timely manner. Um, it's usually within the hour um, that I get a response back. Uh, and whatever questions I have following after that, it's pretty fast and quick. Um, I really haven't had to have any concerns other than, my own, hey, when's my prescription going to be in? Or, hey, can I get labs done? You guys have been way on top of it. I mean, every step of the way from Dr. Rucker to me asking to order labs to, hey, when's my prescription going to be sent? Reverse Medical's done a great job.
It's great to hear. How has your lifestyle, exercise habits, and dietary choices changed since starting TRT to support your overall health?
Yeah, it's changed drastically. Um, I hit a milestone today. Woke up this morning, was like, I'm going to get on the scale. Uh, I'm under 200 pounds for the first time in probably 5, 6 years. Um, my lifestyle has changed. It's given me the confidence uh, to continue, and I'm starting to see big results. I started working out, being consistent before it. Trying to see where I could get, and then starting TRT in December has just elevated everything. It's given me the confidence to really uh, check my check my ego out the door a little bit, kind of humble myself, and be like, yeah, you got to put in the work. Um, I'm eating better. I'm working out very consistently, the most consistent I've ever been. Um, you know, I I probably this is probably physically the best I've ever felt. Just in my short, 2.5 months of starting it. I'm not saying it's not all TRT. There's a lot of hard work that goes involved into it with your diet and consistency on working out and what you put in your mouth. But the TRT has been an amazing tool, and it's for sure showing.
Yeah, it's gonna be like the boost that you need, but only if you're doing all the other stuff right too. So,
Yeah.
yeah, it's like a game changer in a lot of ways. I say like most often that life changing is the phrase that people use all the time for it because it's just you can feel the difference from when you started to when you continued.
Yeah,
Question number five.
I've
Oh,
had
go ahead. Yeah.
said just yeah. I mean, I've had so many lifestyle changes within the last year. From um, my sobriety to really starting to work out. It's like I can't haven't been able to pinpoint. Hey, is it one thing or is it this or is it's I think it's just a snowball effect of everything that you start doing right. It's going to start proving results.
Yeah, and maybe like the best aspect of it is that like it expedites the results so that you feel
Oh,
more
for
immediate
sure.
gratification with that. I think
Oh
that's the
yeah.
biggest obstacle that a lot of people have is like it's a slow process always to get back into shape, but
Yeah.
it helps.
It
It helps it
enhances
up a little
it
bit.
for sure. For sure. Yeah. I'm definitely in being enhanced. Yeah.
Yeah. Can you share some specific results or improvements you've experienced in areas like energy levels, mood, muscle mass, or other aspects of your health?
Yeah, energy has been great. I think I probably started noticing that within like 2 or 3 weeks of first starting it. Like I said, I wasn't critically low, but I did fall in the range of being low and, not being that optimal level that, a man should be. I'm 31 years old and, I shouldn't feel like a 60-year-old man. Uh, but, my mood, my energy has changed. The biggest thing I think I've noticed is the mental clarity of everything. Um, just the kind of I'm not stressed out. I I have a lot going on at work, home, all this stuff. I got kids. We're going back and forth, but it's I've noticed the last 2 months for sure that I've just like, all right, hey, we're gonna get this done. So the mental clarity, mood, um, boosting self confidence has been huge. Um, Obviously, I'm stronger in the gym. My I'm going harder, going longer, feeling great. Recovery is better. Um, Everything you pretty much read, you know, your libido is better. Um, if you get on it, you got to tell your old lady to watch out sometimes. So, you, you know that you're coming through, but no, it's good, man. It's literally it's changed how I felt that I'm spreading the word and got my dad on it. He was real low, so and he's starting to feel the amazing effects of it just in the first month.
Yeah, that's awesome. It's great to hear. Something that you guys can share together too. All right, question number 6. What advice or insights would you give to others who may be considering TRT with reverse medical based on your personal experience?
Yeah. First and foremost, do your research. Do your own research. Um, this is your body. This is your health. You guys, Dr. Rucker and Reverse Medical is there to help guide us through the process. Is how I envision it. Help guide us through the journey because it really is a journey. It's not something you should take lightly. There's a lot of benefits to being on TRT, but there's a lot of things you have to stay on top of. It's not something that you can just take and do whatever you want. You gotta depending on what your goal is, you got to stick with it. It's not the do all drug, but it definitely helps. Um, just stay in contact, ask questions to Dr. Rucker's team and Reverse Medical. They're going to answer you back. Uh, there's no dumb questions when it comes to this. Um, you know, but overall, it is your health, and stay on top of it and listen to Dr. Rucker and his team, and they'll guide you through.
How do you envision your future health and well-being journey with the continued use of TRT?
Oh man, I'm just getting started, and I'm already feeling great. I'm already seeing the body composition change with I with the diet, with TRT, with being consistent. Um, I'm seeing me go to a whole new that I've never got to achieve before. Um, I I'm in it for the long haul. It's not something I'm just doing for this year because it's a new year or anything like that. This is now my life. They say it takes 30 days to create a habit. I've been at it for 2.5 months. So my habit's been made, and this is the new me. I'm working out, eating right, staying active, taking care of my body, myself, trying to be the best I can be, trying to be optimal. I think that's the best thing with TRT is you're looking to be optimal, and that's what I'm here.
Have there been any unexpected or surprising aspects of your experience with TRT that you'd like to share?
Um, no, I don't think so. I did so much research. I'm kind of like a research addict. When I find something, I just hone in and I research every negative, every positive. I think if I had to choose one, it's the mental clarity. It's just the attitude of everything has changed for me. Um, and maybe the self-confidence. I didn't expect to be this, confident with it. Not like, cocky or anything. It's just how you just go about. You're like, yeah, man, I can handle that. I got this. You know, the other stuff is great. It's awesome. It really does help. But I think that all it attributes to you feeling self-confident about yourself, feeling like yourself again, man. I feel great. 31. I'm not super old or nothing, but you know, if you've done EMS or public safety or even a nurse in the hospital for a while or a doctor in the ER, it wears on you. It wears on you fast, especially if you're in a high call volume system with a lot of reps. The the highs and lows and the cortisol levels that you get throughout the day on your shift, and most of us work a second job, so work is life, right? And it's just kind of it just made everything a lot easier.